wonderful, the beautiful, the Zach Martin.
Yeah!
As a young man, my uncle went off to pharmacy school after high school because his brother was a pharmacist and he really looked up to him. So he went through college, got his pharmaceutical license, became a pharmacist. At some point in his career, he got injured somehow, and he prescribed himself Vicodin. Well, at that point, he was really well off. He was making good money. He had a family. He had a baby girl, and started taking Vicodin. He also had a drinking problem. So with the mix of that, it got really bad, and so it spiraled downward. Got super addicted to Vicodin. Ruined his marriage, he lost his license, and that happened. So, now you see the good and bad in Vicodin. It's very good when you're a pharmacist and you sell it. It's bad, you just get addicted to it. Have you ever taken Vicodin? Maybe you had your wisdom teeth pulled out. I have to do that pretty soon, actually. But my research has shown Vicodin is a pain reliever. For mild to severe, or moderate to severe pain. Knowing about Vicodin can bring understanding to your use if you ever have to take it one day. So today we'll be learning about Vicodin. Vicodin is the combination of, excuse my pronunciation of these, acetaminophen and hydrocodone. Hydrocodone is an opiate pain reliever, and acetaminophen is a less potent pain reliever, which is also an anti-inflammatory, and that actually increases the effects of hydrocodone in the pill. Some side effects of Vicodin are as follows. It may cause liver damage or death, as most drugs. May cause nausea, constipation, diarrhea, headaches, impaired thinking or reaction, anxiety, mood changes, blurred vision, ringing in your ears, and dry mouth. So there's a lot of side effects of Vicodin, but they're not too often happening when taking Vicodin. They're mild. Little side note about Vicodin. It's actually faster acting. It's proven it's faster acting when you crush it up and you snort it. It gets into your system, I guess, a lot quicker. Positive effects of Vicodin. It's proven to be a great pain reliever. People have used it for many years now. A quick example, my brother got his wisdom teeth taken out when he was about 16 years old, and afterwards, he was in an excruciating amount of pain, is what he tells me. And so the dentist prescribed him Vicodin. So he took Vicodin, and it was perfect. He was out for like 3 days, and he was fine. And afterwards, he didn't have to use it anymore, and he was perfect. So that's the good end of Vicodin when it works really well and you know how to use it correctly. Now let's take the opposite side. Let's look at the opposite side effects of Vicodin, the bad side. What should I start with? Well, let's start with a story. There's a guy named L.K. This is according to a guy named Mark Choki from About.com. And this is a little story about a guy named L.K. He was prescribed Vicodin for a broken shoulder. And 2 weeks after his injury, he was taking Vicodin, obviously. He noticed that this dosage was not really holding up his pain anymore because he started having more and more pain. So he started taking more. 2 weeks later, he had gone through a month with his dosage, just because he had kept taking him off occasion and sooner than when he should have. After running out of Vicodin, he went to his doctor asking for more. He's like, "You shouldn't be coming back this early. This is way too fast. This is too fast. You're taking too much." So the doctor denied him. He started going to other doctors and other dentists and other places to try to get more Vicodin. He was addicted. He got hooked onto it and started taking over all of his life and his time. At According to the American Pain Foundation, 2/3 of adults will have back pain during their lifetime, and it is the leading cause of disability in Americans under 45 years old. Another fun fact, a side effect, no, not a side effect. Study done in Chicago. No, this isn't it. Yes, this is it. Patients took morphine and Vicodin, and patients who took the Vicodin experienced a liking, an elevated liking, or a take again, and they rated it that way, over the morphine. But in conclusion, with knowledge of both sides of Vicodin, good and the bad, you can see, and now you can make a choice of whether you want to use it, or now you have information about it. Being well-informed will set you up for making informed decisions and bringing success to your choices. Let my uncle's story be a lesson to you. There's good sides and there's bad